Number one, your platform needs to drive more insights on the data synthesis and analysis for their providers so they can really spend the time with patients and make sure that your technology is.
Hi, Payal. Thank you so much for joining us today. It's a pleasure to have you on the podcast. And we are very much excited to talk about your organization, Thymos Health. And I think the name itself is very interesting. So I think we can start with this, how you came up with this name. Is there any vision? Is there any story behind it? I think it can be a good starting point for our conversation.
Thymos comes from a Greek word which represents fire. Fire can be viewed as both constructive and destructive. And so what we are is the middle world where we're taking the best in evidence-based Eastern and Western medicine, combining with the practical applications, whereas a human who may be at a junction where they're not doing well, that is a chapter in one's life. It is
Right.
about recognizing that how do we use a data-driven approach to better understand what is happening with your health, to help let go of modalities that may not be serving you well in terms of maybe conventional solutions that may actually cause harm, or it's a guinea pig approach where you say, well, try this, will this work? If not, let's do that. But that human in the loop, our goal is that the fire is first representing do no harm. How do we fundamentally help you on your journey let go of the patterns from the solutions that you're using to let go of what's causing you harm? And how do we meet you on the path to help you really heal from the inside out?
Right. It makes sense. Thank you. It's very inspiring. And I want to, I think you covered a little bit, but if you can elaborate that what you feel is broken in the typical healthcare system, especially around autoimmune care that you are trying to solve using Thymos.
Well, our current healthcare system is very narrowly minded, highly specialized system that is built on not driving outcomes. We have made an assumption that high volume utilization will translate to people getting healthier. It's actually done the opposite. When your models are designed that you need to use a system that is there when you're getting sick often, you're
Right.
naturally not going to you're not going to come out of there like jumping up for joy saying, wow, I'm free and I never have to enter that hospital system again. Now, if you turn it around, the way that we've thought about it is that with autoimmunity, it is a space that most people are not trained in. We have predominantly more than 75% of healthcare providers are specialists. They're really good at a very specific vertical, but do not have the breadth to really understand the whole body. And also in the context of this person, where how you think, how you feel, your environment and your genetic profile are unique to you. Our current system is designed where our research basically narrows it down in a reductive model to say, oh, in seconds, we figured out you have A. If you have A, then the next step is B. And then it's like a general population approach where just follow that protocol and we assume that you are just like the general population and you're going to magically respond to that. Each of us knows that that's not really how things play out. And so from that model with autoimmunity, it is, if you really think about the word, auto is an automatic system, immunity is your immune system. Your immune system impacts every aspect of you. You can't narrow it in to one system like the cardiologist does the heart, or the nephrologist does the kidneys, or the GI does the GI tract. It really impacts a lot of systems. You have to have a whole person approach where you need to understand that autoimmune cases are impacting almost every organ system. But what typically happens is that you get labeled with a complex chronic condition such as rheumatoid arthritis. Everyone stops there. they're not really looking deeper to say this person may also have chronic kidney disease, may have inflammatory bowel disease, may have eye issues. Then that gets deciphered into like many different specialists, but no one is harmonizing any of that. And what we're recognizing is it doesn't work. The person really suffers, the cost skyrockets. And in more than 25% of these cases, within a year to 3 years, that person will progress to complications such as cancer cell growth, heart attack, stroke, dementia, severe multi-organ damage. So typically you hear those outcomes and you get a lot of attention to those outcomes, but none of that stuff happened overnight. It's about how do you go further upstream to recognize that if these issues are addressed early, then we can have a profound impact in changing the trajectory. But too late is very difficult to tackle them.
Right. You are, I think, 100% right in saying that we are treating outcomes, we are not treating the root cause. I think if we focus on the root cause, that can have a better impact on providing the quality care. So if we, in your perspective, how do you want to place Thymos in the whole healthcare ecosystem? Do you want it to be, are you trying to consider it as a provider or as a platform or as a infrastructure layer? How are you positioning it in the big picture of healthcare ecosystem?
We're a tech-enabled service where we are a virtual medical service that trains our physicians on how to be whole person autoimmune specialists. And we're filling in a gap that doesn't exist right now, where there is no actual autoimmune specialist that can care for the whole person by combining their physical, emotional, psychosocial, and epigenetic data in real time, and they refine that care every single week. But also, how do you have a health coach that stands by you 24/7? So you're getting the support you need, not just in consultations, and then coordinate that care with the broader care team. So we see ourselves as a service, and the platform enables us to drive the care to then fundamentally the downstream effect is that all of the entities involved become winners. Right. From the providers, the patients, and the payers.
Yeah. Right. Makes sense. So if we talk about from business perspective, who pays you during this whole process? Are you it's the patients or the providers or the payers? So in your arrangement, how is the billing side of things working?
We are a subscription-based model where ideally over time we are a subcontractor for the payer, the value-based organizations, the self-insured employer, where we're caring for that top 10% most expensive autoimmune patient, or the patient you're flagging to say this disease is getting more complex. And so those patients then are predominantly either paying their copay or a smaller amount, but that their overall monthly service is being covered just as it would otherwise. There is a direct-to-consumer piece so that it doesn't exclude everyone, because if that payer is no longer, you're not contracted with them, that you can still have a D2C model, but it predominantly, we would like to be covered by the entities that are actually, providing your more preventive services.
Sure, I think that also closes the whole loop around value-based healthcare ecosystem as well. So how big is your team right now, and what sort of skill sets you have on your current team? Are there any engineering skill sets? How much of your team in percentage, if we talk about, is comes with clinical expertise? So how big is your current team at the moment?
Our team is around a dozen people. I am the one full-time person. Everyone else is part-time, because we have bootstrapped our entire company and we've raised a tiny friends and family round. And so our team is, most of the individuals are from the technical side to help us actually build out both the platform and then the patient-facing mobile app. We also have an operations manager to help us actually coordinate all of these. I'm the primary medical advisor and scientist, but there's also been an advisory team to help us get to where we are today.
Right. Right.
And then there is an individual who, and so we continue to keep expanding our medical advisory board because of the complexity of what we're doing, but we also have brought in individuals who can help us better understand the payer side.
Right. So I'm sure you talk to many people as part of your business growth. Are there any common misconceptions that you, especially with respect to how autoimmune should be treated, that you run into, and what is your response to those common misconceptions?
Common misconceptions are Thymos is not the first player entering the space. There have been others who have, and unfortunately, within 5 years, they become graveyard businesses. And I think the common misconception is that they may have an amazing team of medical advisors, but it's very rare that someone actually can take into account all the different aspects of a person, number one. Number two, it's about how do you use AI effectively. AI is typically brought in to serve a lot of administrative roles, but on the clinical decision making, there's still a lot of humans in the loop providing the actual service. And so from a business perspective, it becomes actually your biggest cost basis if, as you continue to scale, the human in the loop to provide excellent service is also your most expensive piece that you can't really automate per se. And so what I think that the misconceptions are is that, well, other people are doing it, but it's also the limited understanding of how autoimmunity, these complex cases, are so difficult to grasp around. Most of the time, people have not actually ran studies that have actually consistently showed those outcomes, and we have. And
Right.
so I think that the misconceptions are, is this really possible? Can you really cover over 150 plus autoimmune diseases and other complex conditions? Yes, we can, because what we're doing differently is root cause based.
Right.
It's not really based on you have a diagnosis and then here's the standard solution. It's recognizing that there's just many more layers involved and that you have to have both proprietary algorithms that create foundational models in conjunction to AI to actually, I think, twofold. Number one, your platform needs to drive more insights on the data synthesis and analysis for their providers so they can really spend the time with patients and make sure that your technology is safe. And it's really helping you increase patient self-service time, because as you scale, you need to be able to graduate people from a severe sickness state, but you need to be with them along the journey. And you need to build your business models so that you can support that. If people get better, that's not really how business models are designed in healthcare. We actually, if you step away, if you get better and better and better, are you going to keep paying for the service? Right?
Right.
So from that lens, it's also about how do you build a business model where you're actually having lots of revenue streams that you become the partnership that, may also be partnering with pharma because you're actually surfacing a lot of data that they are interested in. You can get patients into clinical trials. You can also manage those patients. So I think from that lens, there is a lot of assumptions that have led to some of those companies failing. And two, medicine is very, very complex in the United States. So to realize that if you're just saying, hey, I'm going to get the payer to pay for it, I think you have to be realistic about they want you to drive really great outcomes. But how are you going to get paid for it? So it's an interesting thing that as a founder, many founders are so passionate. They're like, our product is amazing, and it is, and they get amazing testimonials, and their physicians love it, but they're still not able to generate enough revenue. And so I think that's the tricky part, is how do you continue to be value added to actually keep every year tripling your revenue and still keep it very lean?
Right. Makes sense. Well, we talked to many companies in this domain. There are a lot of interesting work being done around social determinant of health, because I think we are talking more and more on value-based system instead of pay per visit mechanism. So, in your opinion, the social determinant of health factors, how much they play a role in autoimmune area? Do you feel that any having better social determinant of health platforms out there that can connect multiple entities or multiple agencies together can also help with autoimmune causes as well?
For sure.
Yeah.
I mean, just if you look at the statistics, 80% of autoimmune cases are women.
Right. Uh,
And you can't just sit there and say, okay, it's a woman thing. Well, every woman, based on their ethnicity, sex, their own story, is unique. And
right.
so, you know, this is also an area where we spend the highest amount on the meds. I mean, like if you get on an immunosuppressant such as a biologic, it's thousands a month and it's
Right.
only suppressing your symptoms. And so the social determinants of health are a huge aspect because that plays a huge part in the environmental impact on not just your genetic codes of both your nucleus of your cells and the mitochondria of your cells, but also directly on your microbiome. So we need to realize that that is a massive player. The challenge here is that it's so multifactorial. It's hard to really kind of narrow it down. So if you step away and look at medicine, we kind of say, well, that's very difficult. Why don't we have just a quick reductive model to say, well, I gave you that diagnosis and I'm going to just stop there. I didn't actually take into account in my care plan what is going on with you. And if you really look and see how we separate out mental health versus physical health, there's no such thing.
Right.
That how you think, how you feel, your habits, lifestyle play a direct role in your outcomes. And
Right.
so without that, we really aren't going to shift the trajectory. And we haven't. That's why we've got this huge epidemic of so many chronic diseases that the generations prior had never heard of.
Right. So while when you go and talk to folks, I'm sure what we have observed is that when you talk to the companies, especially about around AI based tools, I think there is always in the back of their mind there is always a little bit curiosity, or they're a little bit skeptical about around the security and safety of their patient data. Uh, because once it is if this is available to AI, sometimes clinicians, especially one who are not technical or who are not very well versed in engineering side of things, they always fear that there might be risk to the safety and privacy or integrity of data. How do you go about addressing this concern with your platform?
In terms of how we use AI effectively
Actively
to
and,
protect the patient.
and securely. Yeah.
Yeah. So again, the foundation of the entire platform has a high level of security to protect the data. So anything that goes out is actually de-identified data from that lens. And so it has a huge, strong infrastructure to make sure that there's not those types of leaks, number one. But two, also in terms of how we provide the care, we have very strong guardrails on the AI because we recognize that most AI models are built on predominantly hospital-based, and those that tend to be very biased. So
Right.
part of it is not just that your information gets leaked. Part of it is also, is that AI actually going to give me the wrong output? And that could be very dangerous for that person. So in terms of like it's not that in the former question you've asked, it's not really all of the guardrails that are there for any electronic medical system have to be implemented before we can actually go live, because those concerns have been there for a long time. I think that's not typically as much of the issue as it is like, how do you actually use your AI models to do good?
Yeah, makes sense. So, your platform, is it integratable with common EMRs out there, or how does its integration works? Like, let's say if we have to integrate with an EMR or any other system, is this integration API based, or what is that the process to accomplish this?
So again, we are a tech-enabled service. That is the first part, which means that we're not selling our platform for other providers to use. We hire our physicians to use the service and provide the service. And so from that lens, we currently, to communicate with other physicians in like outside our Thymos Health, we would be, sending an electronic documentation to them. But in the long term, there'll be an API that will quickly integrate with other systems to streamline it. But it's not as essential at the very beginning because, again, we're not selling our platform for others to use.
Right. So, what is the big picture vision for you? Where you want this platform to be in next 3 years? What is on your roadmap with respect to platform? That what features you are looking to roll out in the platform for in coming years, and likewise in terms of expanding it to other regions, other areas, other geographies. How does your big picture plan looks like for next, let's say, couple of years?
Our big picture is that we will be nationwide fairly rapidly, where we become the autoimmune specialist that's providing a service in a lot of regions that they're almost like medical deserts, where we come in some ways, not just the consultations that are there for you every month where the doctor's spending 45 to 60 minutes, but you're also giving the community support because we provide group consults. So it gives it removes some of that isolation that one otherwise feels, but that in some ways we're also your personalized medical assistant, that as many times as you want, that assistant has all of your data, but it uses your data in conjunction to what's happening with you in real time and really guides you at that moment to help you feel less unsafe and to help you have more insights on this is what's causing me to feel really good, this is what's really working. It's one of the challenges we still face today is that only a few players control all your data. When you can democratize the insights of the data, that knowledge is our real wealth. It's what do we do with the wealth? And we need guidance to know how to take the next steps safely. So we become that entity. We become the partnership for many different healthcare systems that actually has Thymos in the forefront of their minds, where they're saying, instead of like having these huge bottlenecks where patients aren't getting the care they need, we start to reduce that bottleneck. And we also create a more financially viable model so those systems can also get a revenue lift. Beyond that, we have built it so we can move to other parts of the world because in many ways we can have a systemized way that we train our physicians, but that the entire patient self-service piece is a huge asset in many areas that are also dealing with these issues and they really don't have any other solutions. So it's built to actually effectively scale. I think possibly in like 5 to 6 years, I envision us being in a global entity. For now, we want to be effective at really serving what our fundamental goal is that we want to drive more equity into equality because right now that gap is continuing to increase. How do we bring where others have never received, and how do we empower the patient to really take back control of their health in a way that I think the current system strips away from them?
Got it. Makes sense. Thank you. So, final question. If you have to share one advice from your experience, I'm sure you wear many hats as part of your job for this. If you have to share one advice for, because a lot of our listeners are actually individuals who are trying to start platforms like yourself in different verticals of the healthcare. So if you have to share one advice with the listeners from your experience, what that advice would be?
Many founders are very passionate about whatever it is they're building. The passion combined with an immense amount of grit to build lean is a very critical piece. Many will go and say, I need so much capital. But if you don't know what to do with that capital, if you need to be able to take $1 and have it turn into $10.
Right.
That can build scale.
Right. Right. Thank you so much for sharing this powerful advice. And I really appreciate you taking out time and sharing your vision, your insight. I'm sure it's going to be inspiring and useful to our listeners. Thank you so much.